Welcome back. From knots on the head to cuts and scrapes, parents know that kids can be prone to facial injuries. And today we're pleased to welcome UK facial plastic and reconstructive surgeon Dr. Amit Patel with some advice on treating these injuries and also how to minimize scarring, because that's generally a concern for parents as well, to make sure it doesn't worsen. Tell us a little bit about some of the things that you should keep in mind if there is a facial injury.
Well, one of the things that I tell my patients and their families is cuts on the face are very different than cuts on the body. For one, obviously there's cosmetic implications, and the other thing being is that usually injuries on the face end up having a lot of associated bleeding as compared to the body. And so that's something that can get you off guard as you start to take care of something like that.
And when it happens, there are some steps and some things that you should do to treat the injury and try to minimize any scarring. What advice do you have for that?
Well, as far as controlling the bleeding, there's a couple things that I tell my patients to do, and that's one, calm the child down. Easier said than done, obviously, but calming the child down actually reduces the blood pressure and reduces the bleeding. The other thing is just applying something cold, whether it's an ice pack, it can be ice wrapped in a t-shirt, but that actually cools the temperature, shrinks the blood vessels, reduces bleeding. And the other thing that's nice is it actually numbs the area. As far as scarring is concerned, you can probably the key thing is really moisture. Just like we apply lip balm to our lips to help keep them from chapping, you can apply antibiotic ointment or Vaseline to help keep the wound edges nice and moist and essentially plump, and that keeps the edges together and thereby reduces and minimizes the widening of the scar or even dropping of the scar. And
one thing that can be a concern is whether or not a cut calls for stitches. How do you determine knowing if it's serious enough to require stitches or can be treated a different way?
Yeah, this is a question I get a lot from my families, and in general the face is very different again from the body. If it's more than an abrasion or just a scrape on the face, I end up recommending that you at least seek medical advice. And the reason why is because as we smile, we blink, it usually has a tendency to apply kind of a tension on the wound, and so that has a tendency to pull it apart. So if you can see past that top layer of the skin, then you can really take a look here. This picture right here shows an example of why you want to consider doing stitches, and if you take a look on the left, there's just stitches across the top. That leaves a gap below. And so what happens is if that's not closed properly with stitches on the deep layer, that ends up dropping and actually creates an indentation. And that contour deformity over time becomes apparent, and it becomes a cosmetic concern. And so depth is really kind of the key to figuring out whether they need stitches.
And I know there's a great resource for parents and families, caregivers, anybody really dealing with children, available through the University of Kentucky on dealing with some of these injuries. Tell us a little bit about that.
Yeah, UK came up with a very nice brochure that goes through and concisely explains how to take care of different lacerations and different injuries to the face. And it's designed so where you can actually keep it close by where it would come in handy. And you can actually follow through as you're taking care of a child. There's a little perforated card on the back that you can actually pull off and literally follow step by step. And it really helps guide somebody through how to take care of it, because it can be a little bit of an interesting moment whenever it happens to your own child or your own student.
And certainly handy information to have. Maybe put it on the refrigerator along with the poison control number, your doctor's numbers, all those important things. And if you're interested in learning more about that, I believe we're going to have the phone number. There it is, for the UK Facial Plastic Surgery Department. Thank you so much, Dr. Patel, for being back with us.
Thank you for having me.